First of all, welcome and thank you for joining us for this evening's webinar titled Sodium Hypochlorite Wash, a Clinical Review, featuring Dr. Anwar, who is the founder and CEO of TopMD, and Dr. Christine Romine, who's a board-certified dermatologist out of Phoenix. So with that, I'll go ahead and turn it over to Dr. Anwar.
Nicole, thank you very much, and we appreciate everybody joining us this evening. I'd like to go over a product line that we invented in Dallas, myself and Dr. Cockrell. And just in way of background, I'm unable to move the slide, so do I have control? Oh, there we go.
Would you like me to progress it one more slide?
Yeah.
You've got it.
Okay. Thank you very much. Anyway, I came into the field as a patient. I'm an interventional cardiologist in practice for over 2 decades in Dallas. I have a lot of experience in medical devices and developing coronary stents and syringes and so forth. In 2007-2008 period, I suffered a MRSA cellulitis and was treated with antibiotics, and my good friend and neighbor, Dr. Cockrell, treated me and then subsequently recommended bleach baths as a preventive measure and also Hypochlorite. And after using Hypochlorite, which was quite drying, and then bleach baths, after a couple months were really quite cumbersome, quarter cup of Clorox in half a tub of water, basically diluting your Clorox bottle 1,000-fold, and then you'd sit in it for 10 minutes and then rinse off. Things that you're very familiar with. I was not familiar with that. And I went back to Clay and I said, this is really pretty interesting, but it's really quite cumbersome to use as a patient. And he goes, I know. So we embarked on creating a product that would, emulate a bleach bath. And as you know, microbes and skin inflammation are involved in a significant number of skin conditions, including eczema and atopic dermatitis. Other infectious problems are noted in athletes, which involve bacteria or fungi, and then acne is also worsened by P. acnes, and so forth. We're also now learning that radiation causes pure inflammatory response and probably some superinfection, which Dr. Romine will go over in more detail. I also found that in the care of skin diseases, often proper cleansing is perhaps ignored, and there aren't really a lot of very good cleansers out there which are safe to use on a daily basis and non-drying. So the sodium hypochlorite or bleach bath or Dakin type solutions, which have been around for decades and have been used for decades, seem to have really excellent pathophysiology, but were cumbersome to use. Also, I noted at that time that bleach baths were often used in children with atopic dermatitis and created a tremendous scare within the parent population when one told them to use bleach baths. So that was the premise of forming CLn Skincare and formulating a daily cleanser line that could be used in the shower for 1 or 2 minutes and simplifying the regimen. Bleach baths are known to be antimicrobial, it's antifungal and antibacterial in nature. It has recently been shown out of the Stanford group to be anti-inflammatory, working through NFKB. However, the patient compliance is poor, the product is cumbersome, and it cannot be used above the neck, especially in children. Our goal was to create a product that had the same good benefits, antimicrobial, anti-inflammatory, but was easier to use. It could be used head to toe, and we created CLn or Clean Body Wash, which basically is a combination of water, 3 surfactants, and sodium hypochlorite, which is used as a preservative. We can't really call it an active ingredient. And we then, after forming the product, ran a lot of safety testing on the product, including an epiocular test to be sure that it was non-toxic or non-irritating to the eye, although it will burn if it gets in the eye, but it's non-irritating. Patch testing was done to show no skin irritation or sensitization, and it also had very good antimicrobial effectiveness, meaning that you put 5 different microbes into a bottle of CLN, and within a couple of days, all those were dead. All those microbes were dead. Most products that we use are well preserved, and the microbes die within 7 days, but within CLN, they die in less than 2 days. We also did some basic microbiology work on it, where we showed that the kill times were excellent at 30 and 60 seconds with P. acnes, and within 2, 3, and 5 minutes for Staph Aureus. Now, the product was formulated in such a way that it could be used on a daily basis and could be gentle, but it also had modest antibacterial activity. The CLN body wash, which is the lead product, is really quite simple to use. We recommend wetting the affected area and then turning the water off. This is something that we need to really remind ourselves to do that. And then lathering the product just with your hands onto the body for a couple of minutes. And we chose 2 minutes because we showed some modest kill time against staph for 2 minutes. And we actually found out in our experience that leaving it on for 2 or 3 minutes, especially in the lower extremities, was really quite beneficial, and rubbing it in almost like a surgical scrub. And then also paying some attention to the nail beds. And then after you lather the product on, you can just rinse it thoroughly. It rinses very well without any residual feeling. And after using the product, you can apply a moisturizer or any other product that you want. It can be, and the clean can be used on hair, face, and body. I do recommend not using a washcloth, because a washcloth really takes a lot of the product and it doesn't foam as well, although you can use a scrubber or a loofah or some very thin nylon. The scrubber is really quite helpful on the upper back. So essentially it's a gel soap which is left on for a couple minutes on the skin. So after developing the product and doing some internal testing, we went ahead and did a feasibility study in children with eczema that was actually moderate to severe, and they were all culture positive, and no antibiotics or bleach baths were used. And we found in this 12-week study that the eczema was significantly improved with reduction of the IgA score and BSA, and the children, the parent really liked the product and liked it much better than bleach baths and would recommend it to others. And this study was published in the Journal of Pediatric Dermatology in 2013, and that's available in the references on the slide deck. Here's a example of a child who'd been on antibiotics for 42 days. Autry was at this time 2 years old, been in and out of the hospital with IV antibiotics, cellulitis. At one time she also had some osteo. And then within a few weeks of daily use of the product, her eczema was definitely improved. And now 4 years later, she's been doing incredibly well, has been completely off the steroids and antibiotics. And during any flares, she would, her parents would use the product. And they actually used the product on 3 out of the 4 kids in the family. So huge impact on this child. So we went ahead and did a second study in Houston and Northwestern by Dr. Abair and Dr. Paller, who are luminaries in the field of pediatric dermatology. Again, moderate to severe eczema in 50 children. 6-week study. They were all culture positive. Again, no antibiotics were used. These were generally impethogenized atopic patients, and they used the product once a day. and it was a 6-week study, and they noted dramatic improvement on a number of parameters, which I'll show you, including itching and quality of life. And there was also a reduction in the steroid usage by about 25% and a reduction of Staph aureus colonization. Here you can see that the EASI score was reduced at 2 weeks and then also at 6 weeks by about 46% from baseline. The body surface area involvement also at 6 weeks was reduced by a third, and IgA as well by about a third from baseline. The quality of life indices improved for the child. The child felt better immediately, actually, within the first visit of 2 weeks, and then the parents' quality of life was improved, on the subsequent 6-week visit, and that was really quite rewarding. Also, itching was reduced by about 40%. All the patients were culture positive at baseline, and at 2 weeks, 64% were culture positive. And then we also did some PCR testing, and there was a trend in reduction in methicillin-resistant Staph aureus PCR measurements at 2 weeks versus baseline. This study was presented in part in the World Congress of Dermatology in June of 2015, and we're expecting that it will be published sometime this year, full manuscript. Here are some examples. Palmar surface of a young child. Within a few weeks, actually, they get dramatically better. Here's the popliteal fossa of a child, dramatically better in 6 weeks. Generally, the results are seen within less than 2 weeks. So in summary, the second study, called the CLean study, without antibiotics, showed excellent safety, eczema improved, reduced itching, quality of life improved, reduced steroid usage, and reduced staph colonization. The other products that are available, which are sodium hypochlorite based, include the Aureus gel and hydrogel and sprays. These products are prescription products, generally in the $300 range, and the body wash is available in dermatologist offices and also online with a cost of anywhere from $25 to $35 per bottle, and this will last 1 to 2 months depending on the size of the child or patient. As I learned, the standard staph decolonization protocols now include bleach baths. That's really the standard, as well as Hypocleanse, and it should be actually 4% Hypocleanse for a wash. And then we think going forward, CLn may be a good alternative for some of these patients that cannot tolerate a bleach bath or can use Hypocleanse. Our product, the body wash, is the hero product, and it's a gel cleanser. And it's really marketed in 2 different ways, as a body wash and a spore wash. And the reason we did that, it's the same product, but the eczema population and parents and so on and so forth, or the hygiene uses, the body wash sort of makes sense, but a teenager who is more in athletics and so on, they may need a larger bottle, and the sport wash really resonates better with them. But it is the same formula. Now, we also realize that although many people can benefit from the sport wash and the body wash, we realize that some folks are really very dry, those that have been on acne treatment, or they're in dry climates, or they're just very, very dry. We've added some products that have glycerin in them. The facial cleanser and the gentle shampoo have glycerin in them. And then we also realize that there are individuals that need a little bit extra cleansing, and so adding sal acid in a number of our products actually has been beneficial. We've got a acne cleanser which has 0.5% sal acid in a monograph level, and then the shampoo also has salicylic acid in a low concentration, non-monograph level, which has been really quite effective in folliculitis, and I'll go over some of those uses in a different chart. In a simplistic, non-dermatologist way, I look at the skin as a surface where at times it gets compromised either by internal processes, such as an allergic reaction to a drug or eczema, etc., or external with radiation or a burn or surgery or wrestling, which puts tension on the skin. When you combine that with 150 microbes on the skin, you may have various pathologies occur, such as redness, itching, inflammation, and infection, and a sodium hypochlorite wash, which would be non-irritating, would be an excellent option to cleanse these patients with compromised skin. The products, and you can go through these slides, are available in various forms. Are available in a cylinder in larger volumes, or in a self, a one-way valve airless containers for travel. We initially thought that we needed to have a very sophisticated container for these products, but over time we've realized that a simple cylinder bottle is also effective. The Mega Pump one-way valve containers are really liked by some folks because it delivers a very metered dose of 0.8 mLs of product, and a little bit of product really goes a long way because it's quite a concentrated product. The pH of this is 7.8. We don't do anything to really alter the pH, and the sodium hypochlorite is a preservative. Sport wash is the same. It's just available in larger bottles. And the facial cleanser, the pH is adjusted a little bit lower. It's a completely different product with moisturizer, skin conditioners, and glycerin, and very good product for those with eczema or really dry skin or rosacea. And it's available in 2.5 and 3.4 fluid ounces. The shampoo is probably a really prominent product, which is quite useful in folliculitis and sebderm, and Dr. Romine can go over more of her experience on that, so I'll leave that to her. But it has a salicylic acid in it, and I would say that the shampoo is best used 1 to 3 times per week. If it's used on a daily basis, I think it'll be too drying. And that's the shampoo, by the way, is an excellent product, especially for African American population, females that may wash their hair once a week. We've had very good results with sebderm and folliculitis in that population. We also realized that removing the salicylic acid from the shampoo, creating a gentle shampoo, has been beneficial in that, and the glycerin makes it more moisturizing. So without the salicylic acid, the 2 shampoos can be maybe used on alternating days if that's necessary. But often really just the CLn shampoo would probably do the work, 1 to 3 times per week. The hand and foot wash I'm not really going to go over very much since it's not used as much as probably more of a podiatry product, but in the patients who have onychomycosis, etc., that might be a very good product as a preventive product. The acne cleanser has a 0.5% sal acid, as I mentioned earlier. It does not discolor the clothing. It's essentially the same product as the body wash, but with added salicylic acid. And the facial moisturizer is just a simple moisturizer that we have that is really well liked. It does not contain any sodium hypochlorite. It has ceramide complex and is been really well received. It's very light. It's non-greasy. It does not clog the pores, but really nothing different than some of the other products that are out there. I put together a best practices chart together, and we really can handle 5 different types of conditions with these type of washes. The first category being compromised skin, and the one that we have the most experience with, and that could be patients with eczema or even radiation dermatitis. And I think the go-to product, the body wash, will be a very, very good product for that individual. If they've got very, very dry skin, you can use the facial cleanser in that population. The other category would be those that need extra hygiene or have some staph colonization. You know, you can either use the body wash or the sport wash for that general hygiene. Somebody that has athlete's foot or malodorous feet, they can use the hand and foot wash or the sport wash. And then pre and post operatively, the sport wash or body wash can be used as well. So as dermatologists, you can figure out a lot better than I can on how you would use those products. The third category is folliculitis. This is probably the most significant area that we contribute to, and I would just use the body wash or sport wash really as your go-to product for folliculitis. And for any procedure that you do to remove hair, whether it's laser or shaving, etc., and those with pseudofolliculitis barbae, these products are really, really wonderful to use prior or after and as maintenance. And then we've kind of gone over some of the shampoos with dermatitis and dandruff. You can either use the clean shampoo for oily scalp, and if the scalp is very dry or sensitive, the gentle shampoo can be used. And then lastly, for acne, certainly the acne cleanser can be the lead product for most situations, whereas if somebody has really dry skin, the facial cleanser may be an option, although it has some glycerin in it. And then for back acne, we think the sport wash will probably be the best product, especially applied with a scrubber. In your slide deck, you will see that there are some references, and those references in the PDF are actually live, meaning that it'll take you to that reference. And I encourage you to go to reference number 2, which was a study out of Stanford on showing the impact of bleach baths in mice, which showed that it was anti-inflammatory and also anti-aging. So that's was really quite fascinating. I won't go over that now, but I think it might be worthwhile for you to just flip through Figure 4 and Figure 6 in that study, and then some of the other references include some of the publications about our product. The products are available on the Shout store, and you can email us if you needed more detail on that, but we encourage everybody to go through the Shout store to buy the product. If the Shout store is not available to you, the product certainly is available online and also for dispensing in your office in other ways. So I'd like to turn the mic over to Dr. Romine, who has probably the world's largest experience with our products, much more so than we do here. And I'm a non-practicing, I'm not a practicing dermatologist, I'm a cardiologist, so she's going to give you more day-to-day insight into our products. And every time I talk to her, I learn something more about how to use the products better. Dr. Romine?
Good afternoon, everyone. Thank you so very much for joining us. And like Dr. Anwar said, I have been using Clean in my practice for about 2 years and have had great results. As time goes on, I find many new applications for these washes. So I'll go over some purely experience-based examples this afternoon. I'm just trying to get to be able to advance my slides. There we go. Thank you. All right. So I've been practicing dermatology for just over 20 years, and I've done general dermatology as well as Mohs surgery, and I'm doing more and more cosmetic and laser procedures as time goes on. And I don't see a lot of general derm in my personal practice, but I do have a physician's assistant who sees a lot of my general derm, as well as another physician in my office who sees general dermatology. So these products are used throughout our office in all of our general derm patients with common inflammatory conditions, as well as our Mohs surgical patients. And more recently, over the last couple of years, especially in our superficial radiation therapy patients, and more now over the last 6 months in our resurfacing patients. So I'll go over my personal experience. The common conditions that are treated with Clean are acne, folliculitis, seborrheic dermatitis, eczema, psoriasis, and Grovers. And acne especially, of course, is very inflammatory. We see patients day in and day out with acne. So many patients, more so now than ever, and their parents are not wanting to go on oral antibiotics. They don't like the drying effects of many of the topicals, as well as the bleaching effects of benzoyl peroxide. So what I found is that this is a nice addition to our armamentarium. Our patients use this in the shower and they rinse off. There's no bleaching with the product whatsoever. It's really easy to use. For back acne, I typically recommend the Sport Wash, which is the same as the body wash. And I actually have found some really nice loofah towels that I just give to my patients when they pick this up in the office for back acne. And it's been a great addition to our other products that we recommend for this condition. I have a lot of athletes in my practice that, in addition to acne, they get folliculitis, they get tinea pedis, and I'm really convinced that addition of the Clean washes, this has been decreased significantly. Of course, we all deal with seborrheic dermatitis, and that is a condition where there's significant amount of inflammation as well as scaling, irritation, itchiness. This is seen, most commonly on the scalp, but also on the face, in beard area, in the V distribution of the neck, and elsewhere. The shampoo is especially good for this, the one containing the salicylic acid, because it really does help decrease the scaling as well as the inflammation. My patients have reported significant decrease in itchiness and irritation. I've really not found, I know that Dr. Anwar said that they recommended 1 to 3 times per week, but I do have patients with severe seborrheic dermatitis that use it on a daily basis, and I've really never had any complaints of irritation or drying effects. The patients in my practice that I do Mohs surgery on, lots of them are elderly, and especially the gentlemen, I find, have more of an issue with seborrheic dermatitis. And I really believe that that condition leads to increased risk of infection perioperatively as well. So when these are my patients, not my referral patients, but when they're my patients, I put them on the clean shampoo prior to surgery, and I've really noticed decrease in inflammation of the wound afterwards. There's not as much of a risk for any issues with reaction to bandages afterwards. For those surgeons in the audience, we all know that it's sort of a nightmare to see a patient with really bad seborrheic dermatitis because you know they're not going to be washing properly after the surgery either. So if we're able to use a wash instead of putting our patients on prophylactic antibiotics, this would certainly serve us well and the community in the long term. Psoriasis is clearly a condition where clean wash has shown significant promise in my practice. Of course, any skin disease that has issues with barrier can benefit from the anti-inflammatory and antimicrobial effects of this. So in addition to, you know, other gentle skincare instructions and topicals and biologics, I've really found that the clean washes have been instrumental in allowing us to decrease the use of steroids significantly and all the side effects that come from that. Eczema is a condition that we all see regularly, whether it be in our very own children and in our population. Of course, this is barrier dysfunction as well, and the use of steroids is very, very common in this condition. So if there's any anti-inflammatory product that we can use to decrease the amount of steroids that we use, I always consider that to be beneficial. We've had a number of young patients, pediatric patients, that have been sent to me to try to get a handle on their eczema. Their pediatricians have them on pretty significant steroids, topical triamcinolone, and sometimes even stronger, and they're just not able to get them clear. And we actually have placed them on clean washes, and we completely get them off steroids. And of course, parents are relieved because they're very worried about the potential side effects, even long-lasting side effects of long-term use of steroids. And of course, Grover's disease is not as frequently seen, but you know, itchy inflammatory condition, chronic condition of the trunk that I have personally found in my practice to benefit significantly from the routine use of the clean washes. Patients are amazed that they don't have to use topical steroids nearly as often. The other alternative, as Dr. Anwar had mentioned, was the Aureus and Atropro, which in my practice, you know, I'm finding that these type products require prior authorizations, lots of staff time to get, and they're quite expensive. So it's been a wonderful addition to our armamentarium. So as I mentioned earlier, you know, as we all know, steroids can cause issues with atrophy, thinning of the skin in long-term use, and I unfortunately just saw a young woman that was treated long-term with a class 1 steroid, Diproline, to her anterior shins for a number of years, and somehow she didn't get the message that she was supposed to take breaks off of it. So both anterior shins are paper thin. You can see telangiectasias or blood vessels showing through, and it's so sad when you see such severe side effects in a young woman, which was inappropriately using steroids for an extended period of time. Whereas if there's a agent or a product that you can use to reduce the need for topical steroids, of course, we can decrease the risk. As a parent of 4 children, now young adults, all of which suffered for some point in their teenage years with acne, I never, as a practitioner, recommended benzoyl peroxides because personally I dislike them very much. They bleach clothing, they bleach brand new towels, and I've heard stories from other parents that they spilled it on their carpet, and it's kind of can be destructive to clothing and other things. So clean has never ever caused any of these issues. And my children, all 4 of them, use it routinely. And of course, as the children of a dermatologist, they get to try everything. And if they don't love it immediately, they quickly put it by the side. But my 4 children have been using this consistently for the last 4 years and come often to the office to grab more. So that's how I know that they love it. It's very gentle. It's not irritating. Personal experience, using it on my face, I have extremely sensitive skin. It has never irritated, bothered me at all. Again, personal experience, it does sting your eyes, but it doesn't hurt them or injure them, and it doesn't lead to redness. It's just temporary stinging. So I would caution parents, if you're going to use this in your children, to be sure and keep it out of baby's eyes. But it's safe to use on their scalps, their faces, over their whole body, and it's very non-irritating. Patients do use it on a daily basis and do not complain of dryness at all. So I think Dr. Anwar went over everything on this slide. The body wash and the sport wash are very similar. I do find that it is more acceptable to young men with acne or folliculitis or those conditions. They accept the sound of the sport wash much better than, say, a body wash. So that's just one little practical tip as far as marketing in your practice. The shampoo is wonderful as it does contain that salicylic acid, so it's great for the patients with seborrheic dermatitis. And, I do have some patients that have a number of these conditions, and I do like to recommend the shampoo just as a shampoo and body wash because, as you know, especially men, they want something really easy. They don't want to use a bunch of different products. So I do have some men who use it as a shampoo and a body wash, head to toe. The glycerin in the face wash and the gentle shampoo is really nice for those extra sensitive patients. Now, additional uses that everyone may not know about are listed here on this next slide. And that includes radiation dermatitis. Is everyone able to hear me, or is there feedback?
We're getting some feedback on the line. It's better now.
Okay, great. Thank you. So for almost 2.5 years now, I've been performing superficial radiation therapy in my office for skin cancer. Despite being a Mohs surgeon, I found many cases, especially of larger tumors on the lower extremities or bald men's scalps, to be extremely difficult just from a practical standpoint as far as closing wounds and having issues with healing post So with radiation, they're delivered in fractions, anywhere from 12 to 17. What we found is that
we're getting a little bit of feedback. Now it's better. There we go.
Thank you. With radiation, because so many treatments are needed, patients are coming in frequently. Each and every time they are seen for treatment, I, of course, deliver the radiation and check out the wound. So early on, I was finding that, especially for somebody, there was some issues with tissue breakdown and then some secondary infections. So quite early on in my SRT experience, I started using the clean washes to see if that might help with tissue breakdown. And of course, it reduced inflammation, it reduced the tissue breakdown, it decreased the risk of infection. I no longer ever use oral antibiotics for any of my SRT patients, which of course patients love to avoid. And in just a little bit, I'll show you a case study that we actually took pictures of a couple of patients. Well, we take pictures of all of our patients, but we have no more infections to report, so we have only one case to show today. But across the board, patients are extremely pleased with the use of the clean washes. And so when patients come in for their simulation or their dress rehearsal, you know, we go through all their wound care instructions, and they start to use the clean washes prior to radiation. Just, you know, similarly to my patients that are coming in for Mohs and resurfacing procedures, they start using these washes prior to the surgery and the procedure. Now, resurfacing procedures, I've started using the clean washes over the last month. And for those of you out there that do any resurfacing, especially on chest, I think, or, you know, off face, and even some on face resurfacing procedures, whether they be fully ablative or fractionated, you know, there is this tendency to get inflammatory papules, folliculitis, acne, whatever you want to call it, post-procedure. And this has been decreased 100% in those patients who actually do start using the products prior to and immediately after the procedure. There's several patients who have not wanted to use it for whatever reason, and consistently, those are the patients that have issues with the folliculitis and acne post-procedure. And I think a lot of it has to do, of course, with the occlusive emollients and products that we have them using afterwards, just in hopes to heal their skin quicker. So this is two patients that underwent superficial radiation therapy in my office, and each of these patients were about the same age. Of course, it's both dorsal right hands. They received the same energy through their superficial radiation treatments. The one on the left actually had one extra treatment than the one on the right. And as you can see, the patient on the right experienced tissue breakdown and this weepiness. The patient complained of rawness, tightness, and burning. And she refused to use the clean wash, and she just said because of expense that she's going to use her own wash over the counter. And of course, the person on the patient on the left, it did beautifully. These are both photographs that were taken on the very last day of treatment. So after, you know, seeing this comparison, we counsel all of our patients on the simulation day that is extremely important and part of their protocol that they, they will be using the clean washes, and we've had no kickback whatsoever. Just trying to get the next slide, sorry. So basically, in my practice, I don't think I have control right now. Someone else has got control. Someone can help me out. Thanks. Okay. So the initial challenges that we had a couple of years ago when we started promoting this to our patients was the cost. Despite our telling them how great the products work and how it would decrease the steroid use, et cetera, there was a little bit of pushback from patients, and they, a lot of them said, oh, well, I'll just use my generic body wash and I'm good. Really, once patients started using it, I felt more comfortable in, not just using my own personal experience as anecdotal information, but patients love the products. They come back and they get more product. And once they use it and have that user's experience, they never push back anymore because they really do realize that it decreases their need for other agents, especially those that they want to stay away from, antibiotics and steroids. And I really tell patients that any inflammatory skin condition can really benefit from this. So many of our diseases in dermatology, like I said earlier, are due to barrier disruption, and there's such a high rate of colonization, like Dr. Anwar spoke to us about. They actually isolated Staph Aureus from 75% of lesional skin in kids with eczema and atopic dermatitis, and in 33% of non-lesional skin samples. So it's a huge issue anytime that barrier is disrupted. Helpful tips, I would just personally recommend that you try it yourself. I think as soon as you do try it yourself, you'll kind of get it, you'll kind of understand it. And just remind your patients that clean is a medical grade wash. It's part of their armamentarium. It will really make our jobs as clinicians much easier because, of course, we all want happy patients. And, regardless if they get it in our office or online or, eventually elsewhere, they're going to have wonderful results, and they're going to be huge advocates of it. So I think that is the end of my formal slides. Does anyone have any questions for me or Dr. Anwar?
Dr. Romine, we did have a question from Dr. Stewart. So Dr. Stewart, I'm going to go ahead and unmute your line if you'd like to ask your question of Dr. Romine.
Can you hear me?
Hi, Adrian.
Hey, Christy. Yeah, I had a patient today with hidradenitis, and of course that's a different. My question, I know, is it's a different pathology, etiology from acne, but it's a difficult condition to treat. And I give them different washes. Sometimes you tell them Hibiclens, benzoyl peroxide. Have you used any of the clean products for those type of patients?
I definitely have, and I think so much of many of the conditions that we treat are barrier, especially location that hidradenitis suppurativa usually presents itself in the groin and the armpits. I think that the colonization in those areas is just rampant with staph and other organisms. And I have used this in conjunction with, our other treatments, and have found that this really decreases the risk of breakouts, irritation from clothing, and I think it's a great addition, and I would advise to have all of your hidradenitis suppurativa patients as well as acne patients on this, just, you know, prophylactically, preventatively.
And would you recommend the sports wash or the body wash, or, I mean, they're the same, so...
I guess, you know, most of our patients are females, at least my hidradenitis suppurativa patients are females, so I think for them, either or. I really do think that the sport wash is much more accepted by males than, you know, those guys, a lot of times they want to use like Lever or Dial, and I sort of cringe when they tell me they're using those products because they're so drying and they're so irritating, and of course HipoCleanse is extremely irritating and extremely drying. So, you know, in addition to being in uncomfortable areas on the body, if those areas become macerated and secondarily infected, you know, even on the surface, not even in the individual lesions, then it's just going to add to the discomfort and dismay of our patients. And, you know, if we can get by without using the other products, you know, Humira I know is great for that now, but if we can decrease the use of that as well as intralesional injections, I think our patients would be very pleased. But yeah, the sport wash and the body wash are identical ingredients.
Thank you.
You're welcome.
Dr. Romine, I'm going to go ahead and unmute all of the lines in case there's additional questions. In the interim, while we're waiting for additional questions, if you could address how maybe you use these products pre and post procedure. Are you there?
I'm here.
Okay.
Sorry about that.
No worries.
My personal practice is about 50% cosmetic, and I do have laser techs and estheticians who do quite a lot of procedures. And over the last 6 months, we've all adopted the clean wash for so many procedures, from, you know, pre-microneedling, pre-laser resurfacing, you know, even our little mini laser peels, anything that disrupts the barrier during our processes benefit significantly from the clean washes. And the especially, like I noted earlier, the folliculitis or acne that comes after resurfacing, and even microneedling has been reduced significantly. This was always an issue. You know, you do a cosmetic procedure on someone, they want to look better, and now, goodness, they've got this huge breakout of folliculitis on their chest, or, you know, from the occlusion of the emollients afterwards, they, you know, start breaking out even on their faces. So since we've started incorporating this pre-procedure, and, you know, I personally used it the night after having fractionated procedures done without any stinging or irritation, and then throughout the post-procedure period. It's hugely significant. You know, patients are delighted with their results, and patients are much happier. And we do incorporate this in the cost of their larger resurfacing procedures. They just go with it because I want to be sure they're going to use it, because of course we want to have happy patients. So, you know, for the smaller procedures like microneedling, these are patients that are going to have a series of treatments, so they just get it prior to their first procedure and they use it continuously throughout the series. Does that answer your question? Are there any other questions?
Christine, this is Mary Lupo. Can you hear me?
Hi, Mary. How are you?
I'm fine. I really don't have a question because I, too, like you, have been using this for a couple of years in my practice, and I have to tell you, I'm not using it in the expansive ways that you have, so thank you for sharing. And I just wanted to tell y'all, I just thought it was a great webinar. I just posted a shout.
Thanks, Mary. Any other questions? Nikki? If Nikki or Jamie is available to see if there's any other questions that have been typed in.
It doesn't look like we have any additional questions this evening, so a big thank you to you, Dr. Romain and Dr. Anwar, for hosting our webinar this evening.
Absolutely. Thanks for having me.
All right. Thank you. Have a great day,
everyone. Thank you, everyone. Thank you.